Hello everyone. I am Dr. Berkkkaratas. In our videos, we have already mentioned mild to moderate erectile dysfunction that benefits from drug treatment, and we were doing shockwave, PRP and vacuum treatment all three together. Now I have added EMS and LIPUS treatment for the last 3 months or so. Therefore, I no longer do triple treatment, but quintuple treatment. Now let's look at the slides right away, because the patients who have followed us here before know this, but those who watch it for the first time do not know much. That's why I recommend that we have videos about erectile dysfunction. Let's watch them please, because it's something that keeps on and on. Here, I made a video called Treatment Applications and Erection Solution. If you remember, I said there that the first thing we will do for a person who does not have erectile dysfunction is to do drug treatment, to try drugs. If the drug is successful, that is, if there is stiffness, then the person can continue with the drug. This is a method, but I said that for a real treatment, we need to do shockwave, PRP and vacuum therapy. We tried medicines, it didn't work, then we did the penile Doppler test and needle therapy, we said stem cell therapy in everyone in suitable patients, and if that doesn't work, we were making penile prostheses. Now, apart from this triple treatment, EMS and LIPUS will be explained a little later. In other words, in muscle simulation and ultrasonic therapy, I added that I now do this quintuple treatment for those with mild, moderate, erectile dysfunction in every session they come. Now, this EMS, that is, muscle simulation, is a treatment that has been applied for many years. It dates back to 1900 to 1993 in erectile dysfunction, where it was first described. There are also new studies. Look, as we have seen 93 years here, there are studies in 2015 and 2020. Like this penile rehabilitation, perfect muscle exercise, biofeedback and muscle simulation are done, and it is very successful. In other words, even when applied alone, it has a success rate of 30 or 40%. How is it done? Very simple application. You give electrical stimulation to the penis area and the breech area below with the device. Look, if we think about what it actually does in this way, first of all, the muscles where the urinary tract passes and the muscles just above the penis. This is how the penis joined in the front. As I said before, it was splitting in half towards the back. That's the breech area. Muscle simulation is done here. At the same time, muscle simulation is performed on the penis. In fact, there is a special tool for this. There is a tool called Erectile, they produced it. But many already EMS devices are doing what he does. The doses are certain. That's how we do it. The treatment takes about 15 minutes, about half an hour. LIPUS is actually not a lot, I mean, it's not as old as EMS, which is that we make shock waves, we produce sound waves with magnetic current, we give it to the penis. This is actually the same thing. The energy source here is that we make low energy sound waves with ultrasonic sound waves. In fact, it's the same as the shock wave, and we do the same way we use the device we use. We do the same with ultrasonics. In other words, I now benefit from the drug in my own clinic, and this is our protocol for treating mild, moderate, hardening, disordered disease. This can be done 1 time a week, 2 times a week. Sometimes they say, "Sir, 2 is good, 1 is good." When EMS and LIPUS are involved, 2 are better, but it can also be done once a week, especially in a shock wave. Shockwave therapy is the main treatment is shockwave, so the others are PRP, EMS, LIPUS. In addition to this, I am currently applying. I don't apply LIPUS to a patient alone and EMS to a patient alone. I don't do P-shot alone, either. If you remember, I made updates of the PRP video. There, PRP could now be used alone. But I still don't think there's enough work, so I definitely use them with the shockwave. What's going on here? It's done once a week or twice a week. We usually do PRP at the beginning and at the end. In the first, 6th session, if the patient comes once a week, we shift the PRP here at that time, since it is the 4th week in the 4th session. EMS takes about 30 minutes, lipus, let's say ultrasonic shock waves, takes 20 minutes. The shock wave also lasts about 15 minutes. We give vacuum. We teach the disease to vacuum. At home, they work for 10 minutes every day. In this way, 6. We do the session. Then we have a 3-week waiting period. We wait. We are observing the situation. We ask again. How are you? Are you okay? And so on. After that, we expect it to show its effect after this treatment after 3 to 4 weeks. Therefore, I switched to the triple protocol, not the triple protocol, in patients with mild to moderate erectile dysfunction. It was already quite a while, but I was only able to take a video of it. Thank you.